Hello, everyone, and welcome to our last Health Reform Beyond the Basics webinar before open enrollment starts. Thank you so much for taking the time to join us today. Most of you have been a part of this project for quite a few years, but for any of you who are new, I am Hallie Cloud, and this is a project of the Center on Budget and Policy Priorities, which is designed to provide training and resources that help explain health coverage options available through the marketplace and through Medicaid. This project is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. We at the Center are a policy nonprofit in DC, and as a reminder, this series is intended for those working on the implementation of health reform and is not intended for press purposes. In this special partnership presentation with the National Immigration Law Center, today's webinar will provide an overview of eligibility for the premium tax credit and Medicaid based on immigration status. It will provide tips on how to navigate the application process for families that include immigrants, and it will touch on understanding and addressing concerns immigrants may have when applying for health programs. So with that, I'm going to introduce our presenters today. We have Shelby Gonzalez, who is a senior policy analyst here at the center. And we have a special guest presenter, Sonia Schwartz, who's a senior policy attorney at the National Immigration Law Center, who will also be presenting with us today. So with that, I'm going to pass it along to Shelby, and thank you so much for joining us today.
Thank you so much, Hallie, and hello, everyone. And I also want to thank Sonia for being with us today. We know it's an especially busy time for you, so we are really grateful that you're able to join us and share your expertise. I'm going to start us off by covering immigrant status-related rules for eligibility for Medicaid and CHIP, and then I'm going to go into marketplace rules as well. You're about to see a bunch of slides with a lot of long lists of statuses, and I really promise that I will not be reading all of these statuses to you, and I also don't think that you need to memorize all of these statuses and what they mean. We have them listed here as a reference for you, and we also have additional resources on our website, including our key facts on immigrant eligibility that includes these lists and fewer pages. So I just recommend that you have those accessible to you when you're helping families so that you can use them as a reference list. And here we go. So in general, when we look at Medicaid and CHIP, we have to think about them as being a little bit stricter than the marketplace when it comes to eligibility based off immigration status. For the most part, people must be US citizens or in an immigration status that's considered qualified. This includes people like lawful permanent residents and a lot of folks that are here in the US for a variety of humanitarian related reasons. And like I said, I won't read all of these to you, but these are generally the folks that we are considered eligible for Medicaid based off of their immigration status. And in many cases, that it's not enough for people to have what is called a qualified immigrant status. Many immigrants must also wait 5 years after getting their qualified status before they're eligible for Medicaid or CHIP. It's really important to note that there are a lot of qualified immigrants that are not subject to the 5-year bar as well. So this includes folks who entered the US before 1996 and have remained here continuously. It also includes folks like refugees and asylees and other qualified immigrants listed here. Like, for example, those who are serving or who have previously served in the military or have a parent or spouse who have served. So, and there's other groups as well. States also have some flexibility to be less strict about their immigrant-related eligibility for children and pregnant women. They can extend coverage to a much broader group of immigrants who are considered to be lawfully residing in the US. So that's the other term. The other standard is lawfully residing. And this option, this is a state option, and many states have taken up these options. They use the term lawfully residing, but the standard really does also match the term that we use in the marketplace setting that is lawfully present. So lawfully residing and lawfully present, when we think about just the groups of statuses that encompass those are pretty much the same. So I'm not gonna go through all of those statuses here, because in a few slides from now, when we go through marketplace coverage, we will go through those statuses. And you'll see that it's a much broader group than the traditional group under Medicaid and CHIP. And as you can see here, it really matters in the Medicaid and CHIP setting, because 2/3 of states have taken up this option for children, and nearly half of the states have done so for pregnant women. So there's also another option that states have through the CHIP program. States can provide pregnant women certain medical services, including prenatal care, regardless of their immigration status. And states also have the option to go beyond what's allowable using federal funds to pay for coverage with state. If they pay with their own state dollars with no federal funds involved, then they can, and many have, or some have, done things to also provide extend coverage to other groups that are outside of these kind of bounds that are set forth in the federal rules. Medicaid is also available to cover certain expenses related to emergency medical conditions for those who meet all of Medicaid requirements except for immigration status. This includes qualified immigrants who are in their 5-year wait. So if you have like a lawful permanent resident, for example, and that person has only been here for 2 years, they meet all other Medicaid requirements except for the fact that they haven't been here the 5 years yet with that status. Well, then that's a person who might be eligible for payment of emergency only services. And there's other groups as well, including people who are undocumented and people who are lawfully present, but they're not qualified immigrants, such as persons with temporary protected status and many other groups, and also people who have DACA. Okay, now I'm gonna go to the marketplace. So like I mentioned earlier, the marketplace is less strict about eligibility based off of immigration status. There are no restrictions on US citizens, and immigrants are eligible if they are in a status that's considered lawfully present. This includes everyone who's eligible for Medicaid based off of their status, and they're all listed here on the left-hand side of this chart. And many others that are listed on the right-hand side of this chart are also lawfully present. So note that even though people with deferred action are included on this list of folks who are lawfully present, folks who get deferred action under the DACA program, the Deferred Action for Childhood Arrivals program, so that specific kind of deferred action, they're not considered to meet this standard. So therefore, they're not eligible to enroll in marketplace coverage, even if they were paying the full premium on their own without any kind of subsidies. I really also want to point out that because there is some confusion about this group, it's not a huge, enormous group. We're talking about less than 800,000 people across the country. So many assisters, or people who provide consumer assistance, are not going to ever, run into somebody in this circumstance. But it isn't, if you do run into folks, it's kind of important to just be on the lookout because what you don't want to do is accidentally help them enroll in coverage, because that would not work out very well for anybody because they're not eligible. And when you talk with folks, they're going to look like a lot of people who are eligible in many ways. They're going to have a social security number, for example. They're going to have, work permit, all these other factors that make them look like they might be eligible. So it's important to note that people specifically with DACA would not be eligible. Certain folks that are in the process applying for immigration status are also included in the list of those considered lawfully present and therefore eligible for marketplace coverage. In some cases, they have to have a work permit. So we have all that kind of listed here for you as a reference. So who's left out of the definition of lawfully present? Well, we have mentioned already, DACA. I went into a tremendous amount of detail for them already. And also people who are undocumented are another big group that you might run into. People who are undocumented or who have DACA are not eligible to purchase qualified health plans in the marketplace, but they might be eligible to get health insurance through other places. So for example, in some cases, they might have access to employer-sponsored insurance. And, you know, I do want to note that we have seen that a lot of times when people do have access to employer-sponsored insurance, they're asked to provide social security numbers, and they may even be asked to provide them many, many times. They should still be able to enroll in coverage and stay enrolled in coverage without providing those social security numbers. But we've seen and heard about a lot of confusion about this. And this might become a point where people might come to you as somebody who provides assistance with getting enrolled in insurance in the community. And this might be a place where you might need to do some extra help to remind health insurance companies that there should be a pathway for people to get and stay enrolled in coverage even if they don't have a social security number to provide. And there are programs that are that people that are undocumented, and for those who are documented, that and other folks too that fit outside of this, that are available to everyone. So we'll go through those in a minute. So here we are. As I mentioned earlier, the Medicaid payment for limited emergency medical services is available for people who meet all of Medicaid's requirements except for immigration status requirements. There are other federal block grant programs, including those that provide access to immunizations, that are also available to all, and other programs providing health services to protect life or safety as well are available to many people and to all, and regardless of their immigration status. And they may also qualify for hospital financial assistance programs, and everyone, regardless of immigration status, can get health services in federally qualified health centers and migrant health centers as well. We're going to go through a quick scenario that kind of illustrates some of these rules. So in this scenario, we have Ricky and Eva and Karina, and Ricky became a lawful permanent resident 2 years ago, and both Eva and Karina are US citizens. Karina was born in the US, and Eva is a naturalized citizen. So note, when I say naturalized citizen, what I mean is that there are citizens, US citizens, that have gone through a specific process to become a US citizen. And that process is referred to as naturalization process. So in this case, the whole family is applying for coverage in our scenario. So we're gonna look at their eligibility based solely off of their immigration citizenship status first. So these questions that we kind of put in this nice little chart here, like the applying for coverage, yes or no, citizen, immigrant status, qualified status, we kind of are asking these questions because these are the questions that are relevant to figure out if somebody's eligible for the different benefit programs. So let's go through these questions with Ricky first. So Ricky is applying for coverage. If Ricky was not applying for coverage, we would have put down NA, not applicable. And then therefore we would not want to even know anything about their citizenship or immigration status from that point on. So that's the reason why we always kind of start off with that kind of question, because when people are applying for coverage, if they might be applying as a whole family, but there might be some people who aren't applying at all. In this case, Ricky is applying for coverage, and he is not a citizen. He is a lawful permanent resident, which is a qualified status for Medicaid eligibility. However, he is subject to the 5-year bar, and because he obtained his lawful permanent resident status only 2 years ago, he has not satisfied that requirement. This means that he's not eligible for Medicaid based off of his immigration status, but he is lawfully present, so he's eligible to enroll in a qualified health plan in the marketplace and may be eligible for subsidies depending on his income. So Eva and Karina's eligibility, they're both applying for coverage and they're both citizens. And because they are citizens, they are potentially eligible for the full range of health insurance affordability programs. In other words, Medicaid or enrollment in qualified health plan in the marketplace, and in the child's case, also the CHIP program. So now let's walk through some special rules in the marketplace that may seem to contradict some other more general rules in the marketplace. First, let's look at Medicare. Most people 65 and over are eligible for Medicare Part A without any kind of premium. Some people are only eligible for Medicare Part A if they pay a premium. People who are not eligible for premium-free Medicare Part A can purchase a marketplace plan and may qualify for subsidies if they're not enrolled in Medicare Part A. To qualify for premium-free Medicare, a person must have worked a certain number of time in the U.S. and paid into Social Security and Medicare through their payroll taxes. In general, people have to have 40 quarters, which equates to 10 years of work credits. They can get credits for work that they complete themselves, and in most cases, they can also get credit for work that their spouses have completed. So here's an example. We have Lynn, who lives with his daughter May and grandson Michael. And Lynn has been a lawful permanent resident for 4 years. He's never worked in the U.S. He has a small pension from work he completed outside of the U.S., and he's not enrolled in Medicare Part A. May provides more than 50% of his support and claims Lynn and her son Michael as a dependent. Their household income puts them at 200% of the federal poverty line. Lynn is eligible to enroll in Marketplace with subsidies, and that is great news for Lynn. But I do want to caution folks, and I share this extra information because of many, many questions that we've gotten from sisters across the country. In this example, Lynn can't apply on his own for PTCs. If a person can be claimed as a tax dependent, then they must indicate that when they're applying for health coverage on the marketplace. Even if that person who could claim them as a tax dependent will choose not to. But in this case, we are going to assume that May can claim Lynn as a tax dependent. Well, we do know in this example, May can claim Lynn as a tax dependent because Lynn lives with her. She pays more than half of his support. Lynn's income is below the gross income test. And since Lynn can be claimed as a tax dependent, he can't go ahead and indicate on the application that he's going to be, claiming his own exemption, that he's going to be his own tax dependent. He would apply for coverage in the marketplace, but he would include May's information about her income and the rest of her household to be able to make the right eligibility determination for subsidies for Lynn, since she's going to be claiming him as a tax dependent. So here's another rule that is seemingly kind of, doesn't fall in line with what we're used to knowing and understanding about eligibility in the marketplace. So let's think about people who are lawfully present, but they're not eligible for Medicaid based off of their immigration status. So remember, Medicaid is stricter when it comes to this standard immigration status, right? So people generally have to have a qualified immigration status. So that leaves out some people who are lawfully present, but they don't have that qualified status. And then they also oftentimes will have to have met the 5-year bar. So that is another way that some people will not be eligible for Medicaid, even though they might have a qualified immigration status. So if a person is lawfully present, but not eligible for Medicaid based off of his or her own status, then that person could qualify for premium tax credits even if their income falls below the poverty line. So the bottom line here is that there's a lot of people who are lawfully present whose income is in that Medicaid range, even below the poverty line, and yet they're eligible for premium tax credits and cost sharing reductions. So this is a special rule that was put in the ACA because lawmakers wanted to make sure that everybody who is lawfully present in the US had a pathway to get access to affordable coverage. And lawmakers knew that there were a lot of lawfully present people in the US that are not eligible for Medicaid because of the strict immigration rules. So this was a way that they could get subsidies even if their income falls below the poverty line. I'm going to go through this in an example of Gina and Adnan, who are a married couple. And Gina is from the Republic of Marshall Islands, a nation covered under the Compact of Free Association, which we refer to as COFA here in this presentation. So Adnan entered the US as a refugee 4 years ago, and he gained LPR status 1 year ago. And Sam, their child, was born in the US and is a US citizen. So we're going to assume that Sam is already enrolled in CHIP. So we're just going to focus on the parents, Gina and Adnan, in this scenario. So Gina and Adnan both work part-time as they're studying, and they estimate that their income will be around $18,800 in 2019, putting their household income just below the poverty line. So we will see what happens. So again, we have these questions again, right? So first we look at the eligibility for them based only off of immigration status. Adnan is a lawful permanent resident, but importantly, he entered the US as a refugee. Refugees are a qualified status that is not subject to the 5-year bar. So even though Adnan has only been here in the US for 4 years, he may be eligible for Medicaid based off of his immigration status because as a refugee, he does not have to meet that 5-year bar restriction. Even when he adjusts his status to LPR, he doesn't lose his existing refugee status. So Adnan could be eligible for either Medicaid or marketplace enrollment depending on the household income, which we'll go into shortly. So Gina's eligibility based off of immigration status. So Gina's from the Marshall Islands, and although she does not have a qualified immigration status for Medicaid, her status is considered lawfully present. So Gina is eligible for marketplace enrollment based off of her immigration status, but is not eligible for Medicaid based off of her immigration status. So now let's look at the fuller picture of what programs Adnan and Gina are eligible for based off of their income and immigration status. To keep this example a little simpler, let's look at how eligibility would play out first in this family if the state had expanded Medicaid. So this is the case where, in many states that have Medicaid expanded for adults. So as a reminder, Adnan and Gina's projected their income is going to be $18,800 a year, putting them just below the poverty line. So Adnan is who we're going to look at first, and he is going to look like he is eligible for Medicaid. As we discussed in the previous slide, he has a qualified status and he's not subject to the 5-year bar. His income is below 138% of the federal poverty line, so he's eligible for Medicaid. Gina is Gina, although she is at the same household income as Adnan, she is not eligible for Medicaid because she does not have a qualified immigration status. So normally people with income below the poverty line are not eligible for PTCs. But as we explained earlier, there are protections for immigrants who are ineligible for Medicaid due to their immigration status. And so in this case, Gina is lawfully present, but she doesn't meet the strict Medicaid immigration requirements. So she is eligible for coverage in the marketplace, and she is still eligible for premium tax credits and cost sharing reductions because of this special rule that I went over earlier. Now let's see what happens if Gina and Adnan live in a state that has not expanded Medicaid. Gina's eligibility has not changed. She is eligible for premium tax credits because she's ineligible for Medicaid based off of her immigration status. Whether or not her state has expanded, Medicaid is really irrelevant in her eligibility. Adnan's eligibility has changed, however. he should be eligible for Medicaid based off of his immigration status and income. But because his state has not expanded Medicaid, he falls into what we talk about, or we refer to as the coverage gap, the same coverage gap that many times citizens fall into as well. So he is not eligible for premium tax credits like Gina because his income is below the poverty line, and he is eligible for Medicaid based off of his immigration status. So he would not be able to get subsidies. So to qualify for premium tax credits, and this is a newer slide for us. So I'm going to tell you a little bit about some special rules for people who are married, but they're non-residents. So to qualify for premium tax credits, an applicant that is married must file jointly with their spouse. That's just a general tax, a piece that we have to work within when we're looking at PTC eligibility. So generally, you cannot file as married filing jointly if either spouse was a non-resident at any time during the tax year. However, a non-resident married to a U.S. citizen or resident can choose to be treated as a U.S. resident and file a joint return. A citizen or resident married to a non-resident who does not choose to be treated as a resident may also file as head of household if they support a child or another closely related relative. So we also added a publication here from the IRS if you would like some additional information about these rules. Okay, we're going to pause there for questions before we continue on with the next section.
Perfect. So again, if you want to type in a question, you can type it into the little Q&A box on your webinar screen. And we'll just take a few questions right now and take the rest at the end of the presentation just to make sure we get through all of the information that we have, and we can stay on a little extra to do questions as well. So first, in a state that uses that lawfully residing standard for children or pregnant women, the sort of expanded state option, would a person with a valid tourist visa meet the immigration requirements to enroll?
So that's a great question. And I want to start by reminding everybody that while we're going through the immigration standards here for eligibility for Medicaid CHIP in the marketplace, you still have to qualify based off of all other standards, and there's a lot of them, right? There's income, and one that really is at the heart of the question that you just asked is the residency standard. So in Medicaid, not enough to have a lawfully residing standard, or if you're in a state that is using that standard for children or pregnant women, you in addition to that, would have to meet all other eligibility requirements, including a residency standard. And a person who has a tourist visa, even if it's a valid tourist visa, cannot, say that they are a resident of that state. So therefore, they would be ineligible for Medicaid, even under this, this lawfully residing thing, because that's a completely separate thing. They just wouldn't meet that the residency requirement.
Perfect. And then for those states that have not taken up the state option to expand Medicaid and CHIP coverage to children, the broader definition for children, are the eligibility rules for children who are immigrants the same as adults then in that case?
Yes.
Excellent. That was an easy one. And then
I have a caveat that there's a few states, a handful of states that even have stricter requirements, and then therefore, the rules that I went through would be applicable to the children, in the states that haven't, used that lawfully residing piece. If a state for some reason has a stricter rule for adults, they can't apply those rules to children. They don't apply those rules to children.
Perfect. Okay, and then we had a couple questions about the Cuban Haitian entrance in regards to the 5-year bar, and there was a little bit of a clarification on whether if that applies to anyone who happens to be an immigrant from Cuba or Haiti, whether they are exempt from the 5-year bar or if they have to enter as specifically as a Cuban Haitian entrant. If
It
you could
would,
just clarify that.
yeah, and Sonia might be able to jump in even more in more detail, but no, there's plenty of immigrants that are here for a variety of reasons from those countries. They might have gotten their status through a family unity pathway. They might have gotten their status because they have temporary protected status, which doesn't even make you a qualified immigrant, So there's all sorts of reasons why somebody might be here. There's a specific group of people who have a specific immigration status that's referred to with those specific words that then are that are both then a qualified immigrant and therefore and also I'm not subject to the 5-year bar. So it's not just anybody from those countries. It's really a specific status.
I'm thumbs upping it. Perfect, Shelby.
Perfect. And then we're going to do 2 more questions, and then we'll do more questions at the end. But for that sort of special rule for lawfully present immigrants who have income below the poverty line, but are ineligible for Medicaid due to their immigration status, and so they're eligible for the premium tax credit. If they apply and are awarded premium tax credit, do they need to file a tax return in that year, even if they have no income?
Yes, they would have to file a tax return in that year. Everybody has to file a tax return and it has to agree that they're going to file a tax return for any year that they're getting subsidies. It's a requirement of the premium tax credit. And again, I just want to underscore that while we're going through the immigration requirements, there's all sorts of other standards that people have to always meet, right? Including things like a filing requirement. So everything still stands. Like you still must meet all of these requirements.
And again, we have lots of other webinars and tools and reference guides and things like that on our Health Reform Beyond the Basics website. So I know that there's a lot of rules, and the rules sort of go on top of other rules. So if you want a refresher or just want to look at some of they're not basic, but the standard rules on eligibility, you can go to that website and find out more there. Okay, last question for right now. Are there any options for immigrants who are visiting short-term on a tourist visa? Would they qualify for coverage through the marketplace?
The tourist visa question. If they're here on a tourist visa, would they qualify for the marketplace?
Oh, the same answer is true that I gave for the Medicaid one. I apologize, I was distracted for a second. But the answer is still the same, that if a person's here with a valid tourist visa, they're still subject to a residency requirement to get coverage in the marketplace, and they would not be able to meet that residency requirement.
Perfect, thank you. And now we're going to pass it along to Sonia Schwartz, who's going to do this section, and we'll take more questions at the end of the presentation, and we'll be monitoring that screen throughout, so you can just type in a question whenever you think of it. You can just type that in. So thanks.
Hi, everyone. This is Sonia Schwartz with the National Immigration Law Center. And thanks so much to the Center on Budget for having us here today to get you ready for open enrollment. In my section, we're going to provide a brief overview about some fears immigrant families have had about public benefits and how you might be able to address some of these concerns. So here are some of the headlines from the past few months about immigrant families that highlight some of the fear they're facing when they consider enrolling in public programs or accessing health care. Some folks are afraid that using public benefits could derail their plans to become a lawful permanent resident, and others fear that completing an application for health coverage, even for a citizen child in their family, could expose the fact that there are non-citizens in the family, even when those folks are not applying for coverage for themselves. There's a general fear out there that information provided when applying for health insurance could be shared and used for immigration enforcement purposes. We're going to cover a little bit about what has been shared by the government in a proposed rule that is currently open for public comment. And it's important to note that the rule that we're going to talk about is nowhere near final at this point. Let's go to the next slide. We're going to talk a little bit about what public charge is today under current policy today. Public charge today comes up in 2 ways. First, when someone seeks to become a lawful permanent resident, and second, when they seek to enter the U.S. from abroad. Public charge does not come up when someone has a green card already or is already a lawful permanent resident and is seeking to become a naturalized citizen. Immigration officials can reject applications in those two ways I said when it comes up, if they believe the person is likely to become a public charge or primarily reliant on the government for support. In determining whether or not someone passes the public charge test in the US today, immigration officers look at a few things, and I'm going to walk through those. They look at two different kinds of benefits use. The first kind is past or current receipt of cash assistance, and that could be the cash assistance provided through TANF, not TANF childcare, other benefits, just the cash benefits in TANF. SSI, which is a cash program also for low-income people with disabilities that meet the disability standard in that program, or local general or state level general assistance in the form of cash. Another type of public benefit that they can look at is past or current receipt of long-term care in an institution paid for by government. This generally tends to be long-term care in an institution like a nursing home, provided when the benefits are funded by Medicaid, but there are a couple of states that also have state-funded long-term care programs. In addition to looking at those public benefits I mentioned, and only those that I mentioned, government officials can also look at other factors like age, someone's health, their family status, their income and financial status, and their education and skills. However, in practice today, if there's a concern with one of the factors I just mentioned, immigration officials generally look to something called an affidavit of support. And if you're not familiar with this document, it's actually a form that the immigration agency provides that is a binding that a sponsor signs when sponsoring an immigrant to, for example, get their green card. And it's actually a binding contract between a sponsor and an immigrant that says that the sponsor has the resources to support the immigrant if needed, if they should need assistance and they don't have enough income, to live on their own. Generally today, if the sponsor meets the income criteria for the affidavit of support, the applicant or the immigrant is not considered likely to become a public charge. So again, if the person, even if the person has they have a concern about the person's age or their ability to work or their income, if they have a valid binding affidavit of support, the government generally does not decide that that person is a public charge. Let's go to the next. We are faced with a proposed rule that would greatly expand who would be considered a public charge. Again, this is a proposed rule. It was proposed in the Federal Register just a couple weeks ago. The comment period is currently open. It has not taken effect yet. It doesn't change policy yet. Cool. The proposed rule basically changes the public charge policy in three ways, and I'm going to walk through those. First, it changes the definition from someone who relies on government for their main source of support. Remember, I said primarily dependent on government, to someone who participates in certain health, nutrition, or housing benefits to support work. The second way in which it changes the test, the proposed rule would change the test if it were final, is that immigration officials could include additional benefits in the test and not just look at cash assistance or long-term care. Remember, I showed you on the slide before this that right now they can only look at cash assistance or long-term care in an institution. So the additional benefits include most of Medicaid. There is an exception for emergency services in Medicaid, and there's also an exception for services that children with disabilities receive in school. SNAP, which is the new name for the food stamp program, the Supplemental Nutrition Assistance Program, and housing assistance. That could be Section 8, or it could be vouchers for housing assistance as well, and also subsidies to help Medicare beneficiaries of low incomes afford prescription drugs. In addition, immigrants can fail the totality of circumstances test based on the factors I mentioned before. And again, this is if the proposed rule is final. It's not final yet. They can look at the factors like age, health, income, education, and skills. And the proposed rule includes details about how these factors can be taken into account. It includes negative factors like having a low income, not speaking English well, or being too young or too old for immigration officials to think that you can adequately work to support yourself. I just wanted to note that the Center on Budget did some research and discovered that about 1/3 of US born citizens are basically receiving one of those 3 major benefits that we talked about. And so they might fail the test, but we don't know for sure because of the positive factors. So important takeaways. Again, I can't say this enough. The rule is only in the proposed rule stage and it has a long way to go before there's any policy change. The comment period's open till December 10th. Then the administration has to go through and walk through every single comment and balance everything that's been provided in the comments and justify the rule, and then they could publish a final rule. So far, there are about 20,000 comments in and counting, and we think they're going to keep coming in, so they're going to have a lot to wade through. And just also to keep in mind that some proposed rules and even some healthcare rules that you may be aware of are actually never finalized because they're just too complicated to really put in place. One thing that's also a caution to keep in mind is that the rule as proposed is not retroactive. So the policies proposed in there, like the new benefits that were added that I mentioned, like Medicaid, would not be counted in public charge determinations in the US until 60 days after the rule is finalized. So I just wanted to go over, in addition, some of the main takeaways about the narrower policy that's in place today. So some people now or in the future are not subject to the public charge test. And these are protections that exist in statute, so they can't be changed by a final regulation. Some of the groups that are not subject to the public charge test include refugees and asylees. They include survivors of domestic violence, human trafficking, or other serious crimes. And you can see here also some vulnerable juveniles, certain parolees, and some other non-citizens that we have listed out in some of our materials. Another really important thing to remember, and I mentioned this before, is that once someone has their green card and they're applying to become a naturalized citizen, they do not go through a public charge determination again. The only way that public charge tests come up for lawful permanent residents is if they leave the country for more than 6 months at once and they re-enter. There are also certain benefits that I just wanted to be clear about would not count under the proposed rule, even if it were finalized. First, only benefits received by the individual actually applying for the green card in the US count toward a public charge determination. So for example, if a mom is applying for a green card in the US and her daughter receives Medicaid or SNAP, the daughter's use of benefits would not count against the mom in the mom's public charge determination. Also, any program not explicitly listed in the rule will not count toward a public charge determination. So in terms of healthcare, I didn't list out all the programs, but I wanted to list out in terms of healthcare, the following are not included in a public charge determination: marketplace coverage and subsidies, the Children's Health Insurance Program, but I have an asterisk there because the Department of Homeland Security did include a question about whether CHIP should be included in the final rule. So just keep that in mind. We have to watch that. And then certain Medicaid funded services in schools for children with disabilities, and also certain Medicaid funded services to treat an emergency medical condition.
Guessing that a lot of people are going to have good questions for Sonia, so I'm going to try my best to go as quickly as possible on these other slides. So, a lot of people are, as Sonia said, are going to be really fearful of accessing benefits for a variety of reasons. They might be fearful because of public charge, they might be fearful because of enforcement activity. One thing that it's really important for people who are helping people enroll in coverage to know is that there are really very strict privacy rules that protect families applying for health insurance, including mixed immigration status families, where some members are eligible and others are not eligible for the program and for the programs. And some of them might have, some of them might be undocumented, some of them might be documented. Who knows, right? In these families. So any information that's provided in the process of applying for Medicaid CHIP and marketplace coverage may only be used to determine the individual's eligibility for the programs and not for other purposes. People who disclose information inappropriately about people have big consequences, including monetary consequences, that they could be in big trouble for disclosing that kind of information. So I wanted to make sure that people understood that that's something to be thinking about. The other thing is that many families that include immigrants with different immigration statuses and U.S. citizens, also when they're applying for coverage, they want to make sure it's really important for them to not disclose anything about immigration status for family members who they might be sensitive about disclosing that information. The good news is that in applications for Medicaid and CHIP in the marketplace, there should be a pathway that allows for both people who are applicants, people who are applying for coverage, as well as people who are non-applicants. And non-applicants do not have to share any information about their citizenship or immigration status in the applications. Now, they have to provide other information, right, like income and all sorts of other information, but they do not have to disclose anything about their immigration status. And on healthcare.gov, you can see the screenshots here that kind of show you how that pathway works. Healthcare.gov is going to try and find out who's applying for coverage. And if you say that that other members are applying but not Jane the taxpayer, that's one way. And then each time you put in an individual within the application, they're also going to ask you if this individual is going to be applying for coverage. Some important rules around the request for Social Security numbers. For Medicaid, in the case that people are applying for Medicaid or CHIP coverage for themselves, people are generally required to provide a Social Security number, but coverage cannot be denied or delayed while somebody is in the process of applying for an SSN. And Medicaid agencies must help people who are in that application process if they ask for help. So that's important to know. And there are certain applicants who do not have to provide a Social Security number at all. And that includes people like, for example, newborns who don't have an SSN yet, they while they're in the process, right? Like we mentioned above, they're in the process, they don't have to provide an SSN. Then there's certain people who have religious objections that don't want to provide a Social Security number. And then there's certain lawfully present immigrants who are not eligible for a Social Security number and can only get a Social Security number for non-work purposes, such as certain domestic violence survivors and trafficking survivors, asylum applicants, and others. All of those folks are also not required to provide a Social Security number in the application. In the marketplace, only applicants who have an SSN are required to provide an SSN. In the request for Social Security numbers for non-applicants, it's going to happen. Applications are going to ask non-applicants for Social Security numbers, and oftentimes they'll ask for them over and over again. In the Medicaid, non-applicant household members never have to provide a Social Security number in the application if they choose not to. To the extent that somebody has no problem providing a Social Security number, they don't mind sharing that information and they're non-applicant, great, share it, because then that's going to help with some of the verification processes that happen, all this electronic data matching that happens. But to the extent anybody feels the least bit concerned about it, they do not have to provide it as non-applicants. In the marketplace, non-applicant household members should not be required to provide a Social Security number unless all of the following are true. The non-applicant is the tax filer. An SSN is not required for non-applicant tax dependents, so just keep that in mind. The non-applicant has a Social Security number, and the non-applicant has filed the federal tax return in the last year. So again, as I mentioned beforehand, providing an SSN can be helpful sometimes because it helps with the data matching issues, but certainly nobody should ever feel compelled to provide a Social Security number if they're not required to provide one. And certainly people should not also be asked for individual tax payer identification numbers, or what's referred to as ITINs, when they're applying for health insurance affordability programs. So that's also another piece of information that should not be needed to make an eligibility determination. We included some tips about how to work with families that include non-citizens, including things like don't ask non-applicants to disclose their citizenship or immigration status, and in general, using some kind of broad questions as opposed to, we think when you're talking about immigration statuses, and oftentimes the questions can be difficult to kind of navigate. I mentioned earlier using those lists of all the different statuses that would qualify somebody. That could be a helpful resource as you're showing people, like, do you see yourself in one of these statuses? Not everybody that comes to you is going to say, I'm a lawful permanent resident. I know that. They might even say a different term, like a green card holder, or they might not know, so it's important to help people, through the process and showing them a full list of eligible immigration statuses and asking them to identify if they have one of those and say yes or no, and then moving on from there is more helpful. And that's what the question is asked, on the marketplace application for certain. They ask whether or not somebody has a satisfactory immigration status. They're not asking you specifically what that status is. And then they're asking you next to identify what, document the person has, and then to provide specific numbers. So it isn't a question. So it's not necessarily something that you should be asking people to disclose specifically. Okay, some key things about navigating the application process, and I'm really running out of time, so I'm going to try and go through this pretty quickly, is that, eligible, and also I am actually going to fly through these slides because we just went through a lot of the same information, our data matching webinar that we just had a couple weeks ago, and it is available on video. So you can go through them and at your own leisure and find out the same kind of information. So it's just important things to note that people who attest to being a citizen or an immigrant, their status must be verified. And for most people, that's all done through electronic data matching because of the information that's provided by the applicants in the application process, and then that information is then matched against, either the Department of Homeland Security SAVE system or the Social Security Administration. And, really important to remind everybody to provide accurate information, to provide as much information as you can comfortably provide and accurately provide. That's going to help, to avoid data matching issues. Really being careful about typos, remembering that some people sometimes change their name. The application provides an opportunity for you to input, if you have changed a name and use another name, that can help with data matching issues. To the extent that somebody can't have their eligibility fully determined through all this electronic data matching, in general, people will be given the opportunity to enroll in coverage for a temporary period of time, and they're given information about what documents they can provide to kind of clear up any kind of data matching issues that might have occurred. Helping people with this is super important because this is a lot of times something that really trips people up, and then they have a hard time staying enrolled in coverage. When a data matching issue occurs, it doesn't mean that somebody has provided bad information. It just means that there's a variety of reasons why sometimes this data matching doesn't work. Some of them we just talked about. There might be typos, there might be name changes, all things like that. But then also these databases that are used are not fully complete and have all up-to-date information all the time. So there's a variety of reasons why people might have a data matching issue and are going to need a lot of help overcoming those data matching issues. So to the extent you can help them to provide the right information, make sure that they're making a correct attestation when they're going through the application process, enter all the document numbers that are requested for applicants as much as you can when you're helping them. And by the way, we have listed what numbers are going to be asked for from different cards depending on what document type the individual has selected. We have a new reference guide in our toolbox within Health Reform Beyond the Basics. So I'm not going to go through these slides because you can really use that reference guide, and it's going to tell you all the information that you see on the screen right now about document types, and also where you can look for the numbers, because that can be very tricky. Each card, there's all sorts of iterations of cards. They're pretty tricky to find the right numbers. Like, look at what's circled down there. That's what the number that we're looking for. Like, who knew, right? Look at all those other numbers. So this isn't easy. This is difficult to get the right information in. So that's why Hallie has put together a nice handy reference guide that we really recommend that you utilize. And we provided some tips on how to resolve data matching issues and how to make sure that when you're uploading things, they're getting through all of the many hoops that you have to go through to make sure things are updated in the way that healthcare.gov likes them to be updated. So we provided that information. We want to remind everybody that when somebody has attested to being a U.S. citizen, they have to, and they have a data matching issue. It's not enough oftentimes to just provide one piece of documentation. Oftentimes you need to provide two. On this screen, we have examples of documents that in and of themselves are enough. One document that proves both citizenship and
Mm-hmm.
identity. But if the individual you're working with doesn't have one of these, then you really need to have one document from the left side of this screen, of this table, which it really is looking at, providing a proof of citizenship, and then also something that provides proof of identity, which is on the right-hand side of the screen. I'm going to try and go through this very quickly, although this is kind of a complicated topic. So for people with income that would potentially qualify them for Medicaid, the marketplace must verify that applicants are ineligible for Medicaid based off of their immigration status before they determine that they're eligible for subsidies. So remember when we talked about the examples where people had income below the poverty line or within the Medicaid range? The bottom line here is that the marketplace, when it's trying to go through the process of using data matching to prove different circumstances, it's going to try to prove whether or not somebody has an immigration status that would qualify them for Medicaid or for the marketplace. But it kind of pegs it to what your income is, right? So the marketplace, if it doesn't know anything more, if it can't verify your status electronically, it's going to assume that you fully meet if your income is in the Medicaid range, it's going to assume that you fully meet the Medicaid, eligibility requirement based off of your immigration status until it otherwise knows that you don't. So in other words, somebody who has a data matching issue is going to be treated as if they appear to be Medicaid eligible if their income is in the Medicaid range. And what does that mean? If their income is below 100% of the poverty line and otherwise they are eligible for they appear eligible for Medicaid, they're going to be given the opportunity to enroll in a marketplace plan with no premium tax credits or cost sharing reductions if they don't appear otherwise to be eligible for Medicaid and send them to be sent to Medicaid. And then oftentimes they'll be asked to provide more proof of their immigration status so that they can find out whether or not they meet this special rule. So because we are over time at this point, I'm not going to read this flow chart, but it is kind of important for somebody who's helping folks through the application process when they have income that's either in the Medicaid range and or below the poverty line, to kind of go through these steps. And the reason why I say that is that it is not easy to get the correct eligibility determination for this group. So really understanding what's kind of happening behind the scenes, and that's what we're attempting to do through all of these steps, it's really important so that you can really figure out where people are within this whole maze that occurs, and then really help them navigate through the application process to get the correct eligibility determination for them. And again, I'm not going to go through each of these steps, but I really, again, recommend that you kind of walk through them. And to the extent that you are confused or have additional questions about it, to contact me or help healthcare reform beyond the basics. And then we also just wanted to note that we have a lot of resources here, including the reference guide that we talked about earlier, including some of our friends from the National Immigration Law Center's resources that they have, including some tips for addressing families' concerns when they include, immigrants, and when they're applying for health coverage programs, and how to talk about public charge, some Q&As about DACA, since we talked a bunch about DACA, and other great resources. And one more thing, we also have additional resources on this page. And then I really want to thank Sonia again for joining us for today's webinar. And I know that we're going to I know we're over time, but we're going to go ahead and try and take a few questions.
Thank you. Yes, so we'll take a few questions now. So again, you can type them in, or you can just email us after the webinar too if you have to drop off. We totally understand. And again, we are going to circulate the slides. You'll have all of these links to all of these resources. You'll be able to reference the slides whenever you want. We'll have a video recording of today's presentation. We're going to post everything to healthreformbeyondthebasics.org, and we'll send around an email to all of you that are on our Beyond the Basics email list to let you know when that video recording is ready and up for viewing. Okay, so a couple quick questions. Someone had a question, or sort of a clarification. A couple people had a question on whether the premium tax credit, the subsidies for marketplace coverage, are included as one of the new benefits that are considered in the new public charge rule, in the proposed rule.
So this is Sonia. So the proposed rule does not look at marketplace subsidies. It does not look at enrollment in the marketplace and use that in any way as a negative factor for someone who is going through a public charge test.
The only thing I would add is that right now, nothing's changed, right? So even Medicaid and CHIP or anything else, like nothing's changed. Policy hasn't changed. And like Sonia mentioned, we have a long time before policy is going to change, a very, very long time. We're still in a comment period, right? That doesn't end until December 10th. And then after that, the government will have to review, as Sonia mentioned, there's just a ton of comments that are coming in already each day and more to come. So they're going to have a long, long time. And then even when the rule is final, based off of what the draft rule says today, they're not going to change what benefits that they're going to be looking at and taking into consideration until after 60 days of the final rule being finalized. Nothing has changed again in the U.S. As Sonia mentioned, that there is a little bit of a change in terms of people who are coming in through outside of the U.S. But again, nothing in what it's been proposed in the rule has changed at this time.
And then going back to the application process, do you have what should you do if your primary applicant does not have a social security number? How do you get through the application process in that case? Since the application will ask you many times for a social security number.
And this is so your primary.
If your primary applicant, so someone who is either applying for, who's applying for themselves, or applying for someone else in their family, but they do not have a social security.
In the marketplace.
In the marketplace.
So in the marketplace, we, so they are applying for themselves. So they are applying for insurance for themselves.
Yes.
They only have to provide a social security number. They're only required to provide it if they actually have a social security number. So even though they might be asked 3, 4, 5 times, which they really might, they do not have to provide the social security number. It should be a field that is skippable.
Perfect. And also that is distinct from is distinct from identification proofing for using sort of the healthcare.gov application. And in our past webinar, or not our past webinar, our webinar we did a couple weeks ago about how to prevent and resolve data matching issues, we go into the process for identity proofing. And so we have a lot of information on that and the process for that. So if you have questions on what to do if in that case, and sort of just questions about that process, you can go to that webinar and find out more there. So since we are very over time, I think I'm going to bring the webinar to a close, but you guys all have really, really good questions. So please, if your question didn't get answered, if you have more complicated questions that you would like to be answered offline, please email us. All of our contact emails are on the screen right now. Again, we're going to be distributing the slides and a video recording of today's webinar. We're going to circulate all of that in an email to our Beyond the Basics email list in the next couple of days. We'll post it to healthreformbeyondthebasics.org, so you can always just go there and check. We want to give a really, really huge thank you to Sonia and to NILC. They helped us put this presentation together. They've been really amazing partners through this very, very busy time, so we really appreciate them coming and presenting today. We do not have any webinars scheduled for this at this time. But we will have more webinars after open enrollment. And in the meantime, we're going to continue to develop resources, and we're here to answer any questions that you have during open enrollment. If there are any updates, things that are going on, we will be in contact via email, and we will post things to our website. So we are here even though there aren't any webinars happening right now. Again, all of our materials are posted to Beyond the Basics. We have reference charts, guides, frequently asked questions, key facts, multiple other webinars, so you can kind of go through that plethora of information. And if you have any questions, again, please email us. With that, I'm going to bring the webinar to a close. Thank you again for joining us today so much, and good luck in open enrollment. We start in a little bit over a week, and we just wish you all really, really good luck, and thank you so much for all that you do. And with that, I'm going to bring this to a close. So thank you so much, everyone.